Hello, future nursing officers. Confused with antidotes? Or do you forget which antidote goes with which drug? No more confusion. Remember every antidote in seconds with the smart tricks provided in the video. Firstly, we will study what are antidotes. Antidotes are substances that counteract the toxic effects of drugs or poisons, effectively acting as life saving agents. Means antidotes are those drugs or those substances which will neutralize or will oppose the toxic effect of any drug or poison, and they will act as life saving agents. They work by various mechanisms, including preventing absorption, binding to and neutralizing the toxin, or counteracting its effect on the body. There are various mechanisms by which the antidotes work. That includes preventing absorption. They will prevent the absorption of the drug or the poison. They will bind to and neutralize the toxin, or counteract means oppose its effect on the body. Common antidotes with mnemonics. So now we will study the common antidotes of drugs with simple mnemonics, which will help you easily understand and also remember during your exam. First is beta blockers, and the antidote for beta blockers is glucagon. Beta blockers are the medications that block the effect of adrenaline and non-adrenaline, and particularly the main effects are that they will slow the heart rate or they will maintain the rhythm of the heart mainly. So for beta blockers, the antidote is glucagon. Glucagon will enhance the myocardial activity, will increase the heart rate. So the drug of choice for the toxicity of beta blockers is glucagon. Now the mnemonic is how you have to remember this. Bad boy have a gun. B for bad, B for boy. So you have to remember this B as beta blockers. Have a gun. For gun, the mnemonic gun is for glucagon. So this is bad boy have a gun. You have to remember B, that means beta blockers have a gun. For gun, that is glucagon. So the antidote for beta blockers is glucagon. Our next drug is benzodiazepines, and the antidote is Flumazenil. Benzodiazepine, you know that benzodiazepines are CNS depressants which are used to treat anxiety, insomnia, or seizures. And the antidote for benzodiazepines is Flumazenil. Flumazenil is to reverse the effect of benzodiazepine, and the mnemonic is having flu, don't sit with your benchmate. Flu, whenever one is having flu, we recommend that don't sit with your benchmate. So this is how you can remember. Flu, from flu you can remember Flumazenil. Don't sit with bench. Ben is for benzodiazepine. So here we can remember from this, having flu, don't sit with your benchmate. So flu, that means Flumazenil is the antidote for ben, that is for benzodiazepines. Next drug is opioids, and the antidote for opioids is naloxone. We know that opioids are the analgesic drugs which are used to treat moderate to severe pain, and naloxone is the antidote to opioids that will reverse the effect of opioid if we will administer naloxone in time. And the mnemonic is say no to opioids with naloxone. This is very easy to remember. The four drug names are there in the mnemonics: opioids and naloxone. Say no to opioids with naloxone. Next drug is acetaminophen, which is also known as Tylenol. And the antidote for acetaminophen is N-acetylcysteine. We know that acetaminophen is also an analgesic which we use to treat mild to moderate pains, and the other name for acetaminophen is Tylenol, and the antidote is N-acetylcysteine. N-acetylcysteine is the therapy for, or we can say the antidote for acetaminophen. Now the mnemonic, how we will remember this? Acid loves acid. This is very easy. Acid loves acid. This acid stands for acetaminophen, and the second acid, this acid stands for acid in the acetylcysteine. So acid loves acid. That means acetaminophen antidote is N-acetylcysteine. Also, you can remember the other name for acetaminophen is Tylenol. That means TYL. And in acetyl, TYL. So these are the similar letters in both the drug names. So you can also remember from this, or otherwise you can remember the mnemonic acid loves acid. So the antidote for acetaminophen is N-acetyl cysteine. Our next drug is magnesium sulfate. Magnesium sulfate is mainly used to treat short term constipation or as a soaking solution, we can see. And the antidote for magnesium sulfate is calcium gluconate. Calcium gluconate is the antidote for magnesium sulfate toxicity. How you will remember this? The mnemonic. I eat too much Maggie but don't drink milk. This is very easy. Maggie means MAG, that stands for magnesium, but don't drink milk. Milk, we know milk contains calcium. So this is from Maggie we can remember magnesium sulfate, and from milk we have to remember calcium, that is calcium gluconate. So the mnemonic is I eat too much Maggie but don't drink milk. That means the antidote for magnesium, Maggie from Maggie, that is magnesium sulfate, and the antidote is milk, that means calcium gluconate. Our next drug is heparin. We know heparin is an anticoagulant drug which decreases the clotting activity of the blood, and the antidote for heparin is protamine sulfate. If there is overdose of heparin, mainly low molecular weight heparin during delivery or during the heart surgeries, then we give protamine sulfate by IV. And how we remember this? With the mnemonic protect from heparin with protamine. This is easy to remember. How you can remember protect from heparin with protamine, and there are full names of the drugs heparin and the protamine. So protect from heparin with protamine means the antidote for heparin is protamine. Our next drug is warfarin. Warfarin has the same effect as heparin. This is an oral anticoagulant drug, also used to treat and prevent the blood clots. And the antidote for warfarin is vitamin K. Vitamin K is the antidote which reverses the effect of the warfarin, and vitamin K is administered IV, and the usual dose is 2.5 to 5 mg. How we will remember warfarin for vitamin K? War in another country, don't visit kill zone. War, from war you have to remember warfarin, warfarin. In another country, don't visit kill zone. V and K, that means vitamin K. So war in another country, don't visit kill zone. If there is a war in another country, that means that is a kill zone and we don't have to visit it. That is how we can remember. For war, that is warfarin. If there is overdose of warfarin, but we have to give vitamin K. Our next drug is digoxin. Digoxin is mainly used to treat heart rhythm problems, like in congestive heart failure. We use digoxin drug, and the antidote for digoxin is digibind. Digibind is the antigen binding fragment that is used as an antidote for treating the overdose of digoxin, and the common name for digibind is digifab, which also known commonly it is called digifab, and the mnemonic is digoxin binds to digibind. This is simple. Digoxin binds to digibind, also easy to remember. That means digoxin, that is an antidote, that is a drug, and the overdose of this drug is treated by digibind. So digibind binds to digoxin. Our next drug is isoniazid. Isoniazid, we know this is an antibiotic, and this is used in the treatment of TB. And the antidote for isoniazid is pyridoxine, that is vitamin B6. This is used as an antidote for isoniazid overdose. Mnemonic is I ate 6 bananas. I here stands for isoniazid, and 6 mean, and B, bananas B6, that means vitamin B6, that is pyridoxine. So we can remember I ate 6 bananas means for isoniazid we have to give vitamin B6 as an antidote, and the name for vitamin B6 is pyridoxine. Our next drug is iron. And for iron poisoning, we have to give antidote, that is defroxamine. Defroxamine works as a chelating agent, means defroxamine will bind to the iron molecules and will form a complex which can be excreted from the body through the kidneys. And how we can remember is, we know the other name of iron is ferrous. So ferrous, Fer, and in the word defroxamine there is the similar letter Fe. So, like this, we can remember ferrous, that means for iron poisoning, the antidote is defroxamine. Our next drug is lead. For lead poisoning, if lead poisoning occurs, that means there is buildup of lead in the body, then we have to give the chelating agents like EDTA or Succimer. These chelating agents work similarly. They also form complex and binds with the lead in the body, and these complexes later will be excreted by the kidneys. What will be the mnemonic? Leaders are educated and successful. Leaders, we have to remember led from leaders, are educated. Educated, from the word educated we have to remember EDTA. And successful, successful is the Succimer, the chelating agents EDTA or Succimer that are used for the lead. So we can remember leaders are educated and successful. That means for lead the antidotes are EDTA and suck. From suck we have to remember Succimer and Succimer. Our next drug is carbon monoxide. You know, when there is deficiency of oxygen or increased carbon dioxide, the carbon monoxide poisoning occurs. And for carbon monoxide poisoning, the treatment is 100% oxygen. The person has to breathe pure oxygen that can be given through mask that is placed over nose or mouth, so that the person or the patient can get proper oxygen. How we can remember this? Room full of carbon monoxide, open window, breathe O2. When you will read it, room full of CO, open window, breathe O2. So this is a rhythm. For CO, that means carbon monoxide. CO is carbon monoxide poisoning and O2 is oxygen. So for CO, carbon monoxide poisoning, the antidote is 100% oxygen. Next is mercury. Mercury poisoning. If mercury poisoning occurs, the antidote is dimercaprol. This is the drug for mercury toxicity. How we have to remember mercury? The letters are MER, and in dimercaprol the letters are MER. So for mercury we have to give dimercaprol. Our next drug is tricyclic antidepressants. We know tricyclic antidepressants are used to treat depression or anxiety. Means after taking tricyclic antidepressant, the person mood will light up. And the antidote for overdose of tricyclic antidepressants is sodium bicarbonate. Mnemonic is be happy with NaHCO3. We know that NaHCO3 is the chemical formula for sodium bicarbonate. Be happy. As we know, after taking tricyclic antidepressants, the person's mood will light up. That means the person will become happy. So, to become happy, we take the tricyclic antidepressants, and if there is overdose of tricyclic antidepressants, then we have to give sodium bicarbonate. So be happy with NaHCO3. That means for tricyclic antidepressants, the antidote is sodium bicarbonate. Next is cyanide. Cyanide poisoning mainly occurs because of the exposure to any form of cyanide, and the antidote is hydroxycobalamin, vitamin B12, or sodium thiosulfate. These are the antidotes for cyanide poisoning. How we will remember? Cyan gas makes you blue, B12 saves you. Cyan gas, that means when there is poisoning of cyanide, there are many symptoms: headache, dizziness, fast heart rate, shortness of breath, vomiting. These all symptoms can make you blue, means there can be cyanosis. Cyanosis may occur if there will be decreased or shortness of breath. So cyan gas makes you blue and B12 saves you. B12 means the vitamin B12, that is hydroxycobalamin, will will save you. So, cyanide poisoning, and the antidote is hydroxycobalamin, vitamin B12, or we can also give sodium thiosulfate. So, these were the drugs and their antidotes. These were the common antidotes which are asked in almost every nursing exams. So, these are made easy with these simple tricks to remember. And that's how you master antidotes the smart way with SmartNurse Guide. Thank you.